You try to go to the best programs that will fit you, that will prepare you the best that you want to be prepared. And sometimes the military will say no. Ask Dr. Gray Pre-Med Q&A brought to you by Blueprint MCAT. How you doing today?
I'm doing very good. Thank you for having me.
Yeah, awesome. What can I help you with?
Yeah, so I have for years been watching your channel, and I've seen your 2 videos on the military HPSP scholarship.
Okay.
I'm applying this cycle, and I've actually gotten a little ahead of the game, and I'm already talking with the recruiter, going through the whole process. I actually have my physical scheduled for pretty soon.
Nice.
Before I've even gotten accepted to a med school. So that's obviously, you can't use the scholarship without that.
Yep.
But I wanted to talk to you a little bit about your experience with the scholarship, how it impacted you while you were a student, and a little bit of what you thought as a doctor coming out of med school, and the differences that you felt between civilian versus being a military physician.
Yeah, so just a quick rewind for someone who doesn't know my story. So HPSP, the Health Professions Scholarship Program, is done by the Army, Navy, and Air Force, and now the VA as well has an HPSP scholarship. And so I applied for and received the Air Force HPSP scholarship. And HPSP allows you to go to any accredited, I think you have to be fully accredited, medical school here in the States, MD or DO, and they'll pay for your tuition, give you a monthly stipend. Some of the programs have some bonuses up front to give you some cash in the bank. So at the end of the day, my journey as a medical student was basically no different than anyone else. So when I was on campus, you don't have to wear military clothes. You're not on orders, and so you're technically a civilian, just doing your thing. The Air Force, in my case, was paying for medical school, and I was getting a monthly stipend put into my bank account, which was nice. So from a day-to-day medical school experience, my experience was no different than my wife's, who was also a medical student with me, and not on an HPSP scholarship. Now, for me, I did the commissioned officers training before medical school. So for a few weeks there, I was down in Alabama and was hanging out with my military clothes on and learning how to be a military officer, an Air Force officer. So that was before medical school. And so that didn't affect me as a student. And then typically, historically, they've tried to do something in between first and second year, which is for a lot of medical schools still kind of your last summer as a student before going kind of full bore into being a medical student and then later on as a resident. And so depending on your school, if you do have that summer, then the military will probably expect you to spend some time with them, to be on orders and to go wherever they want you to go and do some more training. If your school doesn't have that traditional summer, then the military goes, oh, well, like we can't use you. And obviously they're awarding you a scholarship to get your medical degree. They're not going to do anything to jeopardize your kind of standing as a student. So they're not going to force you to do anything that's going to interrupt your schooling. So that's really the only difference is you have some training potentially before school, potentially in the middle of school, or not middle, but between first and second year. And if you have no time, right, there are students who get the scholarship too late to do commissioned officer training before school, and the school doesn't have any kind of break in between first and second year, then you're really not doing anything with the military except getting paid and having school paid for until after school, when you need to do all of your officer training and stuff like that. And then sometimes you'll do, typically required is some sort of elective rotation at a military hospital with whatever you're potentially interested in. So I did an orthopedic residency or an orthopedic rotation at the residency program for the Air Force in San Antonio when I was in school.
I guess building off that, one question that has worried me a little bit is if you are going into a normal residency, which is virtually the entire school, and you have a question about how do I prepare myself to be competitive for orthopedics? What kind of things do I need to be doing for OBGYN? You can go to the counselors, and they will have I'm sure, a plethora of advice because that's their entire job. Did you feel like you had difficulty getting advice relative to the military specific residencies you're applying to?
No, because
you go to
it's the same.
Questions.
It's the same. So the residency applications, for the most part, are exactly the same, right? It's a different match process because you're applying to military residencies and you're applying to civilian residencies. You apply to both. But at the end of the day, what they're looking at is basically exactly the same. Are you a good student? Did you pass your step 1? Do you have a good step 2 score? What kind of research do you have? For the military, there are a couple extra things. If you have prior active duty service, which most HPSP students aren't going to have, do you have X, Y, or Z? There are a couple different things on a military rubric, but for the most part, it's exactly the same. What were your preclinical grades? What were your clinical grades? Step scores, all of that stuff. And then there's usually some discretionary residency program director. Oh, you were a great student when you rotated here as a student. I'm going to bump you up a couple extra points because we really liked you. It's no different than any other residency application, civilian wise. It's scores, research, right? Did you do an away rotation there? Did they like you? So it's the same. The advice that you're going to get, the advice that you're going to use is exactly the same. The just nuts and bolts of the match process is going to be a little bit different. Where you apply to the military match, you get the military match results typically mid-December, and that informs your ability to continue in the civilian match, or you pull out of the civilian match because the military says, yep, we want you for orthopedics, and you're going to do it at our military hospital, therefore you don't need to go match in the civilian match.
Kind of building off the match process, I've become familiar with your story of the difficulty of matching in certain specialties in the military, leading to you having to go to a different route before you could reapply. Mm-hmm. So I just wanted to hear what your opinion is on the difficulty of matching into certain specialties versus in the civilian world, given the fact that orthopedics, plastic surgery, like those are also very competitive in the civilian field as well.
Yeah, it's competitive everywhere. So I think the biggest difference is if you aren't on HPSP scholarship, you don't have to apply to a military residency first. The opportunity is, number one, you can apply to every program out there, which is what most students are doing these days, unfortunately. They're just applying everywhere. So I think it increases your odds just for that reason. There are also more students applying for all of those spots as well. So the military is, well, at least for me at the time, there was one orthopedic residency program in the military, in the Air Force. And that was a limitation, but there was also a limitation on the number of students applying for that program as well. It was HPSP people. It was USIS people, USIS, however you want to say it. It was active duty flight surgeons who are then going back and going, okay, I'm done being a flight doc. I want to go do my orthopedics now. So that the number of applicants is less, but the spots are very few and far between. And so if I wasn't in the military and I applied civilian, I could apply to lots of programs, but there's lots more students also applying to those programs as well. The biggest difference is if I didn't get in, if I was a civilian just going through the regular match, if I wouldn't match in orthopedics, let's say, I could then make a decision with what I wanted to do with my life. I could go to the program that I really wanted to go to, and I said, okay, great. I applied to your program. I interviewed at your program. Unfortunately, I didn't make the cut. That's okay. I would love to do research here as a kind of a student, a graduate student or whatever, right? And so you can then go and network and build connections and then reapply for the match the next time and hopefully get in. Versus the Air Force, I was their property. I didn't get my orthopedic spot, so they're like, okay, great, go do an internship year. I reapplied, didn't get my orthopedic spot. I was the first one, I think, that didn't make the cut because they called me 3 days after the match and said, hey, if you can find a program, you can go do your ortho residency. And ortho, unfortunately, is typically not one that goes unfilled. So not an easy problem. And so I didn't get ortho again. And they're like, great, you're going to be a flight doc, right? They already had a plan for me because I was their property, and they need physicians, even general medical officers who only have an internship under their belt. Again, if I wasn't in the military, I could have done whatever I wanted to make myself successful moving forward only with the specialty that I wanted.
Obviously, I think if you're looking towards the HPSP, you should also be researching the military medical school in DC.
Mm-hmm.
And I just wanted to hear what your thoughts were on should you get accepted to that school versus the ability to use the HPSP.
Yeah.
What you would feel the advantages are of either one and why you might choose one over the other.
So I think ultimately you have to decide first and foremost where you're going to be the most successful student. So if it's a civilian medical school and not USIS, then go to the civilian medical school, do the HPSP scholarship, figure it out. With that said, potentially going to USIS, the military medical school, gives you a couple different options. And it also handcuffs you a little bit as well because you owe more time going to USIS. You get paid to be a medical student, which is kind of cool. I think above and beyond what you would have gotten as a stipend through HPSP, you're considered, I think, a staff sergeant or something like that going through medical school. Don't quote me on that, but you go through medical school. I think potentially it opens you up, again, from a networking standpoint, potentially to build better connections with people who are going to make decisions, potentially for residency options. I don't know if there's any data that shows that USIS students match more than HPSP students. It'd be very interesting to see if that data is available. But that potentially would be my one kind of, it may help in that way. But then you also owe, I think, 7 years instead of 4.
As a applicant, I think you're always shooting for the most competitive, at least from an application standpoint, medical school that you can get into.
Why? I want to break that myth.
Well, for me, it's just certain advantages that you have in terms of the access to high-level research. There are certain residencies that I know do prioritize those schools, the Stanfords, the Columbias.
Sure. The arrogance breeds prestige breeds prestige, right? Of like, oh, we at Columbia only look at Columbia, right? So that's fine, right? There are always going to be the hierarchy of we're a prestigious institution and we want all of our students to come from prestigious institutions. But you will also find students at those prestigious institutions, residents at those prestigious institutions who come from Podunk State University, right?
Yeah, absolutely.
So there's no guarantee that going to a competitive medical school is going to land you in one of those residency spots. I wanted to stop you because too many students go for the name and don't think about fit. And then they're miserable for 4 years going, I don't know why I came here. This is not my cup of tea. Everyone here are arrogant jerks because we all thought the same thing and wanted to come to the same place and be competitive against each other. And they're just miserable. And then what typically happens is you don't perform as well because you're miserable and you're burnt out and you're not happy and you're depressed. So you don't do as well in your preclinical years and your clinical years. It rubs off on how you show up on your clinical rotations, and your letters of rec and your evaluations and your clinicals aren't as good as they could have been if you went to the school where you would have been a good fit, but it didn't have the name, right? So I wanted to just pause that thinking for a second.
Yeah,
So,
absolutely.
Okay, I'll let you go.
I totally agree with that. I guess where I was going is I think there are very slight advantages that come with a predisposed thought of the quality of this applicant given the same stats that you're coming into your residency with.
Okay.
There are slight advantages as you go to apply to a residency. And okay. I just wanted to think or hear what you think. If you think it's a little odd, should you go to, let's say, a Harvard and then use an HPSP scholarship towards a military residency that, to the best of my knowledge, doesn't care nearly as much where you're going to school versus if you go to a much more standard state school?
So at the end of the day, I don't understand the question, because the thinking is based on more of what your academic career is going to look like, your professional career, and then you're kind of throwing in HPSP on top of it. Whereas if you want to do HPSP, if you want to be in the military, then who cares where you go to medical school and whether or not doing HPSP is weird or not? Go to the best medical school that you think is best for you. Do HPSP if you want to be in the military. Go do the residency that is going to best serve your needs. And just keep going. And yeah, potentially, if you go to Harvard Medical School and you want to be an orthopedic surgeon and you want to do ortho at Harvard, but you did HPSP, the military may go, sorry, you're going to come down to San Antonio and do ortho down here. And you're like, but I have the best step scores. I went to Harvard Medical School. Like, you should treat me like royalty and let me do what I want. But you're property of Uncle Sam at that point. And so again, it's a balance, right, with HPSP or USIS. Is, do you, first and foremost, do you want to be in the military? And if that answer is yes, then there are two options. You sign up and they pay for medical school, and you understand that there may be some limitations on the back end because of that. And you have to be okay with it. You do the best that you can do. You try to go to the best programs that will fit you, that will prepare you the best that you want to be prepared. And sometimes the military will say no, right? They may, if there's a specific fellowship that maybe that you're interested in, the military may say no. We don't need that training in the military. Therefore, we're not going to let you do that. If that is a huge issue for you and you want to serve in the military, the other option is you go through all of your training, you get in debt from medical school, you do your residency, and then you go knock on their door and say, okay, I'm ready to join. You may be fellowship trained and they still may not want that, but at least you have gone down the path, at least from a training standpoint, that you wanted to go down. And I think it's a great discussion because I don't think enough students really think through those things.
Yeah, I really appreciate that. And I just had one last thing to pick your brain with.
Yeah.
Is at any point, either through your 4 years of medical school or serving out your experience as a flight surgeon, did you kind of hesitate and sit back and think like, oh, this might have been a mistake? Scholarship risk, just doing what almost everyone else in the country was doing?
Yeah, you know what? Obviously, at this point in my life, I don't regret it. It led me to where I am today. The fact that I was able to leave medicine for health reasons, for other things, like and go full time with medical school headquarters and now with MAPT and building software. Like, I was able to do that partly because I was debt free because of the military. So I don't regret it for those reasons. I loved my time in the military. I loved being a flight doc. I love showing pictures. I was just traveling recently and talking to some people who are in pilot training now for the Air Force. And so I was showing them some pictures of me in an F-16, and we were chatting and having fun, right? Those bonds and those connections will never die. The 28-year-old me, or 29-year-old, whenever it was, when I realized that I wasn't going to be able to do orthopedics, I was disappointed, right? That's why I went to medical school. But I didn't dwell in it. I was like, okay, great. What's the next adventure? Like, I can't do this. Part of it was my own fault, not doing well enough on step one, not understanding the importance of step one scores in this whole residency application process. And so I made the decisions I made as a student, as a medical student, and I dealt with those ramifications, and it is what it is. But yeah, obviously super disappointed at the time. But I think looking back on it, I loved what I've done.